Hello, this is lesson number 9, healthcare. Lesson number 9, if we begin with the textbook, discusses and introduces some of the major ethical dilemmas that exist within the medical establishment. Examples are cloning, in vitro fertilization, and other relevant medical ethics. Although those are really important topics. You will note that the majority of the work for this lesson relates back to healthcare delivery and this question of, is healthcare an individual right here in the United States? And I have included significant readings that will help you evaluate this topic. We will be looking at um, first of all, something I wrote and finished back in 2005, one of my graduate theses, and it was titled Healthcare in the United States Since 1920, and it's basically a history of the delivery of healthcare in the U.S. For the past 80 years or so, prior to 2005, and how we ended up with this public-private system that's not really totally private and it's not really public and it's more or less a hybrid, which has caused all kinds of unintentional consequences. And even back as early as the early 2000s, the federal government and federal and state governments were already paying for over half of all healthcare being delivered in the United States. Now that number is much higher. So the implication that we have a private healthcare system, what the medical establishment talks about and media, is just totally inaccurate. It's not true already. Um, and since 2005, there's been multiple attempts to improve upon and create changes in the healthcare systems that at the same time did not cause any medical or political problems for folks who needed those votes. And especially with Medicare changes. Medicare is the federal health insurance program for individuals who are retired, as involved in drawing Social Security within the Social Security Administration, or who have significant disabilities. You may hear Medicaid being discussed many times, and Medicaid is the health insurance company program that's jointly funded federally and via your states to provide services for those of low income who meet certain eligibility requirements. So already between the Medicare system, the Medicaid system, the Veterans Administration, and other federal programs, federal employees and so forth, state employees, your government agencies and entities are providing a significant, over half of all health care that's being delivered already in the states. Since 2005, as I mentioned earlier, there's been all kinds of debates, what should be done, what should not be done, based on the political establishment that holds power in Washington and in your states, with the most recent attempt being the Affordable Care Act, ACA, or also known in the media as Obamacare. You will read in my notes that I'm a big supporter of this effort. I do have a concern, though, that it really did not go too far. In my Pollyanna academic belief, we should have took steps to eliminate private involvement in all healthcare and remove this healthcare obligation from employers to instead to local states and governments. That's a pretty controversial view, especially in this region. And there's some reasons for that, which is really not important, but I want you to read about for this video. But you can read about in the supplemental material I have provided from 2005 until present day. One of the bigger questions of who provides health care, the question that's bigger than that is Is healthcare a right? Is accessing and having available high quality healthcare a right of a citizen? Or is it only a right if you meet certain eligibility criteria, such as being retired, have a job, or meet one of the other current standards? One of those bigger questions is for me, what makes a 65-year-old who is retired any different from a 25-year-old who works but their employer does not provide insurance? Shouldn't we cover the 25-year-old too? Shouldn't everybody be covered? Or why are employers providing, or historically have provided in the past, significant amount of insurance for their employees? How did that come to be? Have you ever thought about why employers provide insurance? And that history goes back to the 1920s and 30s into the 40s that I provided an overview for in my writing. So please take a chance to read that document and read the additional supplemental material. Then I want us to ask ourselves some questions in the discussion boards. We have 2 discussion boards that we'll be participating in. There's no test or journal entries this lesson. I want us to spend our time concentrating on this topic and finishing up our ethics paper that we have been working on. Within this class, I've intentionally tried to not convey my beliefs on most of our topics intentionally, because I did not want to create a desired response reaction, or this idea that Jamie believes one way or the other. Until this lesson, I certainly do believe one way or the other. And I have to question a society that doesn't value the individual enough to take care of basic medical needs. We quickly have a circumstance of haves or have-nots. Actually, we have a circumstance of those who have jobs, who have insurance that may or may not be available. We have those individuals who, with the lowest of incomes, who are being covered by insurance. But we have the middle, the traditional lower class that may not be able to afford insurance, or even middle class, and do not meet the federal eligibility requirements for Medicaid. And that middle is gradually getting bigger based on cost and employment issues. How do we develop a better system? And I'm looking for a better system. Please don't infer that you have to agree with me. You may disagree with me. And I hope we can have those conversations as well. Because the only solution that we have to this current quandary is for folks who have differing views and perceptions about how to solve this solution to start together, collectively, figuring out what options we have that will work for our society. We are the last industrialized nation that does not provide health care on Earth. And there's some pros to that, and there's some cons to that. But when we spend more money than any other nation on health care, and our outcomes are among the lowest on Earth as well, that should tell us that spending a lot of money doesn't necessarily mean that we create a good system. And in what other ways can we improve the system? In what other ways can we create a quality healthcare system that you trust your children to, your parents, your siblings, and yourself? Because this is one ethical topic, as I include in the notes, that all of us will face one way or the other in our lifetime, either as an individual or a friend or family member. And we all have an ethical obligation, and an obligation as a citizen of the nation of the United States and of the world to be part of this solution and to find a solution. Because most will readily admit that at the current pace, the system that we have now is going to collapse on top of itself. by the time, if you have children my age, by the time my children reach adulthood. And I'm much more worried about right now the system that my kids inherit than the system that currently exists that I see in front of me. So let's begin this conversation. This is a topic that I want you to take with you, to think about and to apply to your future decisions and voting mechanisms and when you're involved in the healthcare system. Um, your choices or what you believe is truly yours. But you do have an obligation to be as informed as possible about this topic and to know as much as you can from valid resources from this point forward and on, and to integrate and interact with the political system and the medical system that will be making these decisions in coming years, so that you can be part of the solution to this quandary. This is going to be the biggest issue our generations face that's living, especially my generation that is in its late 30s, and the Generation Xers and folks who are younger than myself. Can we create some system that can be sustained and still produce high quality outcomes? If we can't, we need to start looking at this now, because when the system finally starts falling apart, it's going to be tough to come up with something in a very short period of time, as the Affordable Care Act is an example of. And I've included a really good reading of all the problems associated with the ADA and the lack of foresight, ACA, sorry, with the lack of foresight in politics, and just all the problems and sadness associated with the effort that could have been avoided if we all participate in this decision-making process and make our leaders and politicians and governmental officers accountable to the citizens of this nation. So, what I hope that we can do is this is extremely informational for you. This last lesson for the semester, that it makes you ask some questions, develop some ideas, and strengthens maybe what you believe, or maybe makes you question why you believe what you believe. And is it fact versus reality? And how do these three ethical ideas apply to this topic of healthcare? And can this teach us something? These three ethical theories. Can those theories teach us something? But most of all, I want to convey my thought to each of you that you're all very, very important. Some of you I've met personally. Some of you have only met online or via email or those type of things. But I believe that your value and your level of importance, regardless of your past experiences or geographic location or those things, are as equally important as everyone else. You deserve the same rights and opportunities, and so does your family. So the question is, how do we get there to ensure some type of equitable outcome? And that's what ethics is all about. That's what this lesson is all about. How to ensure the equitable treatment of all citizens who are willing to participate in the process, and even those who are not willing to participate, to the best of our ability. And that's a really, really tough question that I hope in the future you will be willing to consider and ask yourselves, and not be afraid to participate in the debate of. We must be willing to have conversations related to these topics. Hope you enjoyed this lesson, and I look forward to your emails and posts. And take care.